I have been receiving text messages about pulse oximeter. Most of people would like to know how pulse oximeter works, as well as its purpose. Pulse oximeter is a non-invasive medical device that is used to measure oxygen saturation in the blood. It can rapidly detect even small changes in oxygen levels. This level shows how efficiently blood carry oxygen to extremities furthest from the heart, as well as arms and legs, and it is attached to a body, mostly a finger, and it is mostly used by medical practitioners in a critical care setting such as emergency room as well as hospital. The main purpose of this device, pulse oximeter, it is to make sure that the blood is well oxygenated. So when carrying out the test, there are things to follow, the precautions to follow. You need to make sure that on the finger there is no nail polish or dye. Before inserting this finger into a probe, it has to go toward the LED light, and you have to wait half a minute so that it can give the right readings. There are two different readings that indicate on the screen of this machine. There is a oxygen saturation percentage of blood, as well as pulse. So the ideal reading of oxygen saturation, they have to be between 95% to 100%. Then the oxygen is normal. If the values are below 95%, then that means you have low oxygen. So those are the things to follow. The other things that you need to know before carrying the test, you need to sit still. You need to be still so that the readings are corrected properly. Yes, so this is the device, this is the way it works. As you can see, this is the probe. So you need to insert your finger directly like that. Then it will start showing, indicating. On top, it will indicate oxygen saturation. Then down, it indicates pulse. So that is the way it is, and that's how oxygen oximeter is tested. Thank you.